perseverance, passion, intelligence, and empathy. Based on her experience of growing up around addiction and substance abuse, seeing lives lost and changed, she is inspired to give the same education and support to high school students with similar issues. She plans to attend Oklahoma City University to attend a bachelor's in psychology with a minor in child advocacy studies followed by a master's to retain an LPC license to become a child therapist. Ladies and gentlemen, Lillian Schriner.
Good morning, my name is Lillian Schriner, and today I will be talking about my capstone presentation, A Veteran VA High School Drug Education and Support. I started with this broad question, but as you'll see, the question later evolved over time with my continuous research when I discovered what the real problem was. Some of my research included student surveys, literature reviews, and expert consultation. The problem specifically is where I started. Fatal overdoses among youth involved fentanyl increased by 168% just between 2018 to 2022. And any presence of fentanyl-related deaths jumped from 2.7% to 80.8% in just the recent few years. Despite this, and from this, we know that traditional one-week programs do not work for high school students. This graph is based off a research synthesis of finding out if that doesn't work, what does work. And from this, I identified 4 key pillars that establish effective prevention programs. The first one is evidence-based education, so that means proven methods with research backing of each. Next was non-punitive support, so rather than immediately going to discipline, providing help first. And next was community prevention, meaning involving all parts of the student's community, from home life, parents, partners, rather than just relying it all on the school. And finally was long-term sustainable implementation, rather than simple one-time effects that you might recognize as red ribbon week. As you see comparatively, VA high school is extremely lacking in all categories. So based off this, I continued and I conducted a preliminary survey with 13 students, which is a small number, but I am currently working on developing a survey with the high school administration for school-wide. Regardless, I asked students about their awareness and support programs, and 81.8% of students told me they don't even know what support there is or aren't sure of it. And from the students who did know about it, they said they felt that the education that was provided was either outdated, unrealistic, or even traumatizing. And more crucially, a lot of the students said that they were afraid of going to get help even if they needed it out of fear of punishment. This finding was a cornerstone for my entire project going forward. On November 11th, I interviewed Jordan Jensen from ACCI Life Skills, and he told me something that even as a student researching this exact topic, I did not even know about. Since September of 2025, VA High School District has been implementing ACCI Life Skills, which is a cognitive behavioral modules for students in ISP. It is an online evidence-based program with 50 years that shows that it works when properly implemented. The fact that even as researching this, I was unaware of it shows that the awareness gap may be even larger than previously suspected. So this discovery fundamentally changed what I thought my capstone was going to be, from creating something new to how can I improve what already exists. So obviously changed my how might we. In August, I started questioning just the general lack of development of education. But with that new discovery, I developed my new how might we of how do we optimize ACCI's implementation and build awareness for all students, not just those in ISP. I think this evolution shows my understanding of how research deepened. I consulted 3 key experts throughout this project. Derek Blackburn, who's the Assistant Secretary of Health and Safety for a VA district. He personally emphasized the need for scalable solutions and measurable outcomes. He also introduced me to the concept of soft landing protocols, which help students navigate difficult disclosure situations with support rather than punishment. Dr. Kelly Dunn, she is an addiction medicine physician at OSU, and she explained to me the importance of evidence-based practices with person-centered language, something I find that we actually often use here at Vanguard. And then obviously Jordan Jensen explained to me about ACI's cognitive behavior approach and explained to me the importance of proper implementation, of which he believes is not happening at the high school. These combined expertise validated my direction and strengthened my solution. Once I did understand the problem, I moved into ideation and I conducted 4 separate brainstorming sessions. The first one was gathering problems and breaking down solutions. This I did it via 6 thinking hats. Next, I expanded even further on this with updated research. I did this via categories in 2 sessions. And third, I integrated expert feasibility with consultational feedback with the second categories. And my final and 4th one was my matrix of feasibility, viability, and desirability. Across these all sessions, I developed over 30 potential interventions, but my evaluation of ideation and continued research led me to my current idea. My current solution has 3 integrated components. First is to, as I previously mentioned, optimize ACCI's life skills delivery through enhanced facilitator training, supplementary engagement materials, and extending access beyond ISP. Second was building a comprehensive awareness infrastructure. So using the communication channels that I tested a couple weeks ago, I will use these channels then to spread the awareness. So using email, Canvas posters, and peer ambassadors. My third of all is establish non-punitive support. This is currently actually being developed by Derek Blackburn himself and was already taken into initiative by him. So students will develop and find a pathway where rather than being afraid of meeting punishment, they can be consoled that they will not need that. This will help remove any fear-based barriers. Success will be measured both qualitatively and quantitatively. So major targets for quantitative was I'm hoping for a 40% reduction rate in self-reported drug use over time. That means going into the data system and calculating how many drug incidents are reported. Next was a 50% increase in awareness, meaning we cut into that 81.8% gap significantly. This I will probably do it very similarly as previous, where I did a survey on a limbic rating. And finally, a 75 increase in help-seeking behavior. Once again, this will be calculated by just going into data and continuing into looking in communication with counselors. And qualitatively, I will continue to measure whether students report feeling trust with school support, or whether counselors feel confident in implementing these protocols, and whether all 3 experts endorse this approach. My implementation follows a phased approach. Phase 1 is already completed. That was August through November. It included research, expert interviews, and ideation. Phase 2 is currently in progress. This will be from December to February. On this, I will focus on testing prototypes, developing them at Vanguard, and gathering feedback. Phase 3 will be for the remainder of the school year. And this, I will have final refinement and create a comprehensive handoff documentation for VA high school staff while in constant communication. Phase 4 happens after my graduation, so based on approval with Derek Blackburn and high school administrators, they will continue to hold the responsibility of continuing evolution of iteration as it will continue to evolve, but in my handoff structure, I will also provide instructions of how to do that. This capstone embodies what I learned at Vanguard and why it matters to me personally. Vanguard has taught me how to think like a researcher and a designer, using evidence, human-centered design, iteration, and professional collaboration. I grounded every decision in data and focused on a sustainable impact. At the same time, this project is deeply personal to me. Growing up in an AA household, it gave me the protective education about growing up in addiction that many of my peers never have ever received. I saw people relapse and pass, and from that I learned that support and not shame is what people need to recover. So this project is about giving BA high school students the honest, supportive, evidence-based education that I personally was fortunate enough to have. In conclusion, I started by identifying that 81.8% of students do not know what support exists, that students fear punishment, and that existing programs are not being implemented effectively. My solution strengthens evidence-based ACI programs that BA High School already has, increases awareness, and removes fear-based barriers that keep students silent. Together, this will create a scalable, sustainable model for real impact. Thank you for your time and attention. I want to thank especially Derek Blackburn, Dr. Kelly Dunn, Jordan Jensen for their expert guidance. Thank you to all students who participated in surveys, and for Vanguard's faculty for supporting me throughout this. If you have any questions or wish to reach out, please please contact my email.